Good afternoon. Yesterday evening, we reported 97 active cases of coronavirus in Jersey. And today, we expect that number to pass 100 for the first time for quite a while. While there are fortunately no cases in the hospital, this is a critical point for our island and one where it is essential that we lay out the risks for islanders if we do not change our behaviour. Now, we have an excellent test and trace capability, but it is not unlimited and cannot do the whole job of keeping everyone safe. We all have a part to play as a community. And the measures we've implemented so far have suppressed the spread of the virus, but they cannot hold it at bay completely. And following the summer, it is fair to say, many islanders have become far too relaxed in their compliance with public health guidance. So as a result, in the last few weeks, we've seen growth in the number of active cases, not limited to arriving travellers, which due to our travel restrictions are getting smaller and smaller and are mainly now islanders returning home. The growth in numbers is increasingly pockets of community transmission in Jersey, either being found through people seeking healthcare or through contact tracing from existing cases. Now, I want to stress that we are not talking about an outbreak or an epidemic in the island, but we must take all possible steps now to prevent further spread. If we do not, then we face the real possibility of having to introduce stricter measures that will limit islanders' freedoms and pose risks to their mental health and their livelihoods. Now, and to ensure that we do not have to take this drastic path will require your cooperation, your commitment, and your strict adherence to public health guidance. Young people are having significant impact on the growing spread of COVID-19 within our community. And we know through our interviews during the contact tracing process that physical contact between friends, between boyfriends and girlfriends, and the sharing of drinks and vapes is leading to the spread of the virus among younger and asymptomatic carriers. We are now seeing cases that we can trace back to Halloween parties, and this is particularly troubling given the number of warnings we issued about keeping safe during that holiday. So I want to address all young people in Jersey directly and say simply and starkly, you can catch COVID-19, and if you do, you will spread it to your friends and your family. You may not have symptoms, but you could infect someone that will. And while your lives may not be at high risk from COVID-19, those of your family, and especially your older relatives, are. Please think how devastating it would be for you and your family if you were to infect your grandmother or grandfather, and worse still, that led to their deaths. And I know many parents will be watching today, and I hope they will impress this important message to their own children as I have to mine. Individual responsibility is key, and you will know how your family interacts with one another. The virus is in the island, and it could be in your family. While many will change their behaviour and act sensibly, we know that some will not, which is why we've introduced and used enforcement powers. We are aware of house parties that have taken place. We are aware of beach parties that are planned. We will be monitoring and acting when they are putting our island at risk. So please follow the guidelines, especially this weekend, when you might be hosting or attending bonfire night parties. That means an absolute maximum of 20 people at social gatherings with physical distancing of 1 metre closely adhered to. I really do want us to avoid draconian measures. We will not reintroduce any restrictions lightly, but we will act swiftly and in a targeted way if necessary. Next week, ministers will be discussing a revised package of public health measures that will allow us to increase the pressure on the spread of the virus in our community. And over the last week, the State of Jersey Police have been visiting every premises serving food and drink on the island, ensuring they are complying with social distancing and contact tracing requirements. Obviously, the honorary police were also doing that as well. Many were behaving excellently. Some were not. We will be requiring those who aren't up to scratch to improve their practices and reviewing their performance. But it requires a commitment from all of us when going out to eat and drink, which we've said before, to ensure that we are following public health guidance by checking in using the QR codes provided, recording who we are, and using the COVID Alert app. And if you are not asked to check in or no QR code is displayed, then please insist that your details are taken for contact tracing. This is how we behave as a community and keep one another safe. If we don't change our behaviour, then our case numbers will increase and we will face the real possibility of ending up in a lockdown, just like the UK moved into yesterday and France moved into earlier than that. Now, this is not a position that any islanders want to be in, where we risk being unable to see friends and family over the Christmas period. So we must work together to protect our community and the freedoms we've worked so hard to keep over the months by which we've got here. And we must do it now. So I'm now going to hand over to Dr. Ivan Muscat to obviously add some more information. Ivan.
Thank you, Chief Minister. I'd like to provide some further information to illustrate exactly where we are. Basically, we have an increasing threat of COVID, and we need to increase our responsivity to this. The island is at a critical stage. We have moved from isolated cases to more cases and some clusters, and now we are somewhere in the middle of the trajectory between few cases and an outbreak. We're somewhere in the middle with unlinked cases being seen and some clusters, as I've said. And therefore, we are going to find it more and more difficult to manage these cases with the targeted response to individual cases and their direct contacts. We will need to move to more stringent measures if the number of cases increases and the number of unlinked cases gets bigger and clusters get bigger. So where are we precisely? This is a graph that shows the number of cases of COVID in Jersey per 100,000 in the last 14 days. And as you can see, we are at around 89 per 100,000, which looks reasonable compared with the higher figures in France and in the United Kingdom, but is nonetheless a worrying upward trend, and the details behind this increase that concern. Our positivity rate is gently going up. It was 0.7% on the 1st of November. It is now 1% on the 7th of November, on the 6th of November. Still lower than the United Kingdom and France, but the details behind this remain a matter of concern. This graph shows how the number of arrival positive cases contributing to our overall positive cases has gone down with time. That's the blue bars. And the number of non-arrival, non-inbound travel cases has gone up over time. And those are the orange bars. Furthermore, incidents of unknown source are going up. In September, we had one incident of unknown source affecting one person. In October, we had 8 incidents of unknown source with a total of 43 cases in those 8 incidents. And in November to the 5th of November, we also had 8 incidents of unknown source with 24 cases within those 8 incidents. In October, we had 2 clusters. One involving a workforce dinner party and a hospitality venue. The other involving a healthcare site. In November, we had one party and hospitality site cluster and a workforce social event. So the threat is that we have an increasing number of non-arrival positives, and this number of non-arrival positives is increasingly exceeding the number of arrival positives. Additionally, we have an increasing number of unknown source cases with clusters. And many of these unknown source cases and clusters involve young adults in enclosed, crowded, close proximity spaces, such as parties. So how do we respond to this? We need to act more carefully. We need to act more responsibly. We need to make decisions, safe decisions, based on risk. And being in an enclosed, crowded place where you can't maintain social distance is a high-risk situation. We must avoid private gatherings that do not follow guidance, or indeed any gathering that doesn't follow guidance. We need to balance the number of social contacts that we have against the risk that they pose. We need to encourage our children and young adults to avoid gathering in large groups and parties. And we need to know when and where to instigate appropriate safer measures, such as wearing masks in indoor public places, ensuring physical distancing of at least 1 meter and where possible 2 meters. And of course, we need to maintain appropriate hygiene at all times. Washing your hands more than 5 times a day will reduce your risk of catching COVID. Maintaining hygiene in relation to touch surfaces is hugely important, and respiratory hygiene is hugely important as well. As discussed by the Chief Minister, we will be looking at further measures over the next few days, in addition to encouraging strict adherence to public health guidelines and sensible, safe behaviour. If control is lost, unfortunately, stronger, harsher measures will need to be instigated. Thank you.
Thank you, Dr. Muscat, Chief Minister. We are addressing you today because we're concerned that COVID-19 is spreading in the island at a rate which could be slowed down by better adherence to our current public health guidelines. We're a small island and we are all connected. We share acquaintances and mutual friends. We share connections through work, through our families, and through our individual behaviours. Whether those connections are made when buying milk at the local shop, dropping off children at school, stopping to chat with other parents, or sharing an after-work drink with colleagues, or meeting friends on a Saturday night, or catching up with grandparents on a Sunday, the spread of COVID-19 thrives on these connections. Its spread is heavily dependent on our social nature and our daily habits and routines. We absolutely understand it's hard to ask you to social distance from the lifestyles we are so accustomed to, and lucky to enjoy and to maintain distance from those we love and care about. But it is distance which will hold us together through this challenging time. If we are forced into a lockdown scenario, we force ourselves apart. We become isolated from each other. Our social connections become broken, and our way of life stops. Now, we don't want this to happen. We can stay connected, but we can also stay safe. And we stay safe by staying at least 1 meter apart from anyone we do not live with. In fact, if we can stay 2 meters apart, then that is even safer. We stay safe by limiting the number of people we gather and socialise with, and even safer if we keep a record of who those people are and keep them as consistent as possible. Now is the time we are asking you to react. React now that COVID-19 is spreading in our community. We announced the updated COVID strategy for winter on Monday, which outlines how we plan to deal with an increase in cases. We're enhancing our testing capacity to proactively find positive cases in the community, and we will find them. It's important that we do, and that we isolate them and break that connection that the virus thrives on. For the moment, we currently have no COVID-19 patients in the hospital, but should that change, we are well prepared. Our objective this winter is to continue with planned healthcare activity as safely as possible and maintain our general and specialist services in healthcare. Should we need to divert health resources to fight COVID-19, we have ensured we have the available organisational capacity, staffing and infection control management in place to deal with any escalation of cases in the hospital. In order to do that, we have already undertaken the following measures. We have completed an organisational-wide review from our previous experience of COVID-19 and built the learning into our operational plans for our winter response across all our departments. We have established a daily operational hub of senior managers to address safety issues, patient activity and flow, infection protection and control measures, supporting the workforce and to quickly respond to any emerging changes in guidance and policy relating to COVID-19 measures. We have increased the use of PPE, specifically the use of face masks, across all our health and community services buildings to help protect patients and colleagues. Proactive measures are in place to ensure patient flow throughout the hospital is aimed at reducing lengths of stay, delayed transfers of care and readmissions. We have ensured COVID-19 preparedness for any resurgence in hospital admissions, including planning for the possible opening of the Nightingale wing should it be required. It will remain safe for patients to come into the hospital or their GP surgeries for non-COVID related treatments. By increasing the flu vaccination rates across our health and social care staff and the general public, we will help protect the respiratory health of all islanders. So far, almost 1,500 frontline health staff and 37,000 islanders have been vaccinated in record time, which is great news. This level of planning means that we are not only well prepared for any increase in COVID-19 cases, but that the hospital is a safe place for islanders to continue receiving the care and treatment they need. We will continue to see an increase in the number of COVID-19 cases, but what we do not want is to see an increase in clusters and outbreaks. Knowing the pattern of cases is fundamental to the level of action the government will need to take to protect the public. This includes introducing mandatory requirements by law. We are bordering the line that leads to a rise in those concerning case patterns Dr. Muscat has illustrated. We can hold this line if we all react now. Please think about protecting our island and preventing the virus spreading in every decision you take. Act responsibly. Act with a shared purpose to protect our community. Act to make positive impact and help bring Jersey through this pandemic. Thank you.
Right. Well, thank you, Richard, and thank you, Ivan. So, I think we'll skip to questions. ITV.
Thank you. It seems that we've heard a lot of this advice before. I suppose the key point being that it's still just advice, but the difference is we're now at a critical point. Why are we not taking a rather safe than sorry approach at this stage?
I think what we're saying is that we want to get some advance warning out with the increases that we've been seeing, but particularly in advance of the weekend and potential parties. I think the trend that we're starting to see is where this is starting to appear. And which perhaps either Ivan or Richard can comment on, but particularly the young people scenario, they really need to understand that if the behaviour doesn't change, then we will have to go to mandatory. There is a mask law in preparation. We're aiming to get that in, I think, still for debate on the 2nd of December. If we can, it's going through some iterations, and that's when certain things then will start becoming mandatory if needed. But in the ideal world, we'd like to avoid mandatory and go on to common sense and actually going through everything that should be ingrained in people by now, which is about respecting distance and being aware of how lucky we have been. When I say lucky, we led everybody to this position. It's not by chance. But you can actually lose that if you people aren't thinking about what's going on in the jurisdiction around. As we said, UK's gone into lockdown, and France was ahead of them. Ivan, do you want to add? And then maybe Richard.
I think the problem is at least partially, if not largely, due to the fact that many people still believe we are in blissful summer and we haven't moved to the reality of winter, which is more COVID, more time indoors, more spread of COVID, and a gradual escalation through of infection amongst initially young people, young adults, older teenagers, and then beyond that to older people within households, within vulnerable sites, and therefore an escalation to a sort of outbreak situation similar to that seen in other countries. We need to remind ourselves we are no longer in summer, and because of that we need to be much more cautious and much more adherent to public health guidelines, and if we're not, we will have to face more and more COVID and the impact that brings on society as a whole.
In terms of household clusters, you were mentioning that. Is there any? Obviously, there will be cases where not the entire family would be required to self-isolate, but then they haven't got the space or the ability to isolate separately. Are there plans to make facilities available to enable that? I mean, even considering students coming home from university, so that we can avoid potentially these family clusters from developing if they don't need to.
We have in the past winter utilised accommodation outside family units to support healthcare workers and others to isolate away from the families to prevent transmission within the household. And that thinking has not changed. And yes, we are thinking about how we would adapt that to the forthcoming Christmas break for students. The details have not yet been ironed out completely, and I don't know if the Chief Minister or the Minister would like to add to that, but it is certainly something that is being discussed.
Richard, anything to add?
Yes, it is under discussion because it is all part of efforts to contain the spread. And coming back to the remarks you made at the beginning of your question, we do recognise that it might be difficult for people to self-isolate in accommodation that is small, and they cannot effectively do that separately from their family. And where that occurs, the whole family must self-isolate. Otherwise, there's that risk of spread, uncontrolled spread. So that is the present strong guidance, and that must remain. And as to your first question, I mean, all those measures we put in place in the spring, which enabled us to lock down and enforce a physical distancing, I mean, those measures are still there on the statute book. We don't want to bring them in at this stage. We still have a control, but they remain there, and we are developing new pieces of legislation to try and meet these anticipated winter pressures.
Thank you.
Thank you.
Just looking at where the room's laid out. JP, do you want to go? I'm the speaker.
Yes, Stephen Rees from the Jersey Evening Post. Dr. Muscat, you mentioned harsher, stronger measures if we don't act. What precisely would those be? What, if we don't curtail this, what are the harsher, stronger measures? Precisely?
Well, the end point, of course, and hopefully we are working hard to avoid this, but the end point would be lockdown, and of course it is absolutely in all our interests to avoid that. There would be a number of steps that can be taken before that, and as the Chief Minister and Minister noted earlier on, we are discussing various other interim manoeuvres that may be appropriate as we move forward. I think until such time as those measures are discussed and agreed, and some idea of when they will be introduced is also agreed, it will be inappropriate to go through them all, but they would not in the main be dissimilar to the type of measures that were introduced last winter ahead of lockdown.
We know that we're likely to have 100 cases by the end of today. Those being known about active cases, are there any projections for them we don't know about, or any projections for what hospitalisations may be necessary? I mean, we know about some. How many do you think we don't know about, essentially?
I'll let Ivan go for the hospital side, I think, from the projections.
It is difficult to project how many cases we are going to see because of the dynamic nature of the situation. By dynamic, I mean both the force of COVID trying to push up the numbers and our force trying to push down the numbers, and hopefully the force of the population trying to push down the numbers of COVID, which is of course what this press conference is all about. We are asking islanders to acknowledge that COVID numbers are going up because of winter, and that we cannot continue to behave in the way we did in summertime because of that. We need to act much, much more carefully to help bring COVID numbers down, to reverse the direction of travel of COVID numbers, to avoid harsher measures.
Am I allowed to ask one more question? Or?
Let's try and do two each, and then we'll see when we get to the time.
Right,
So, okay. So I think it's Bailiwick next.
Chief Minister, when people break the guidelines or one individual's actions potentially forces a whole year group to isolate at school with all the associated problems that causes families and their loved ones, there's a natural response among islanders to be upset. What can the government do to keep the fabric of this island together to ensure that this winter we don't descend into a society, into an island community riven by blame, anger and recrimination?
I think this is where we go back to how the community helped, what's the word I'm looking for, comported itself, but, behaved essentially in the sort of, March, April and May and even since then, which everybody did voluntarily follow an awful lot of the guidelines, and that's what we really try to enforce back into people's minds. They need to get back into that mindset of acting responsibly. Now, we know, obviously, we've got much better systems in place. We can trace people much quicker, and that's why we're saying that what we're doing is suppressing the increase. But the concern we have is that you can suppress it, but it is still an upward force at the moment, and as I've been saying, there's this balance. But I think, again, it goes back to making sure that people are acting responsibly, and it is, it's at all generations. It is about parents telling their children and demonstrating that responsibility, and actually sometimes it might be about the children reminding their parents. But it needs that sort of self-governing thing. It needs the fact that when we're all talking to our friends, we're not up close, not too close, and we just remember to keep that distance. Now, if we can be doing that, and all the other measures that we've talked about, we've been saying for weeks about wearing masks inside, that's why we put a date in, and as we're seeing today. But all those measures all assist us to actually keep the suppression in place. But that's why we want to reinforce, particularly after the half term, and particularly again with this particular weekend coming up, and general, some people are sort of still in party mode, they really need to start changing that behaviour, because they may not know that they're carrying the virus, but it's then very easy to spread on, as we talked about. Richard, do you want to comment?
Yes, I agree with what the Chief Minister said, but I think if we're talking about a community response, let's consider how we can help each other through this as well, and develop means of doing that, because Some people will find what is happening very difficult to cope with. Some people will feel isolated and anxious, and we should check up on people that we know, that we love, and not just think of ourselves, but think of our friends and neighbours and family members. And you know, that's going to ensure that social contact, and maybe not physically with them, making the phone call, checking in online, just asking if they've got any needs, but talking to them. We must keep on talking and trying to keep a normality, keeping our stress levels down, be that at work or home, because it's going to be quite a few months this winter, of course. Same length as any winter, but it's a long time ahead. I would just encourage everyone to think about how we can act in that way.
I think, you know, if you try and look at a positive side, I think it was actually, I was listening to the radio this morning as I was driving in, and one of the headlines briefly was of it was actually a visitor who'd been self-isolating, but how well she'd been looked after by the whole system, by islanders, by the community. So, you know, that does show, you know, if we do it right, we can do it really, really well, and that's what we want to see. We want to see that behaviour, you know, being reinforced.
Thank you. If there's a theme today referring to Halloween parties last week and potential beach parties coming ahead, it's young people and perhaps late teenagers. Firstly, is the government involved in any targeted education programme with education with schools to get that message across to that particular subset of our community? And secondly, would the government consider a more targeted lockdown involving that area of society?
In terms of how it may be managed, I'll defer to Ivan. What I will say in terms of communications, anybody who's a parent will see I see quite regular emails and letters coming in through the school parenting email system, and the discussion we had within Essential Communications yesterday was about how we get that message out to young people in a slightly different way. So hopefully they are working on it, and certainly that was our desire around the table that they did. So my expectation is we will be something specifically targeted that will reach out to the sort of target audience that you're talking about. Ivan, do you want to talk about some of the other measures? You might want to repeat the second part of your question, actually.
I was just wondering if you were considered any targeted lockdowns, for instance, sixth forms.
We haven't discussed that, but we have discussed, if I may add to what the Chief Minister is saying, how to better communicate with sixth formers and young adults outside schools, bearing in mind that it is their feel that we're still in summer that is driving some of this behaviour. So we are in discussion with SIPES, and we will be in discussion with others to discuss how we can better target this message to those groups of people so that they can understand better what their actions are actually doing. Because they are intrinsically decent, kind people. They just do not seem to understand, perhaps because we haven't explained it well enough to them, that they need to curtail some of their usual behaviours because of COVID, in the same way as we do elsewhere.
Thanks. BBC?
First of all, just a question about the school issues, and we've seen an increase in the number of incidents in schools. How many of the active cases are actually linked to educational establishments at the moment? And will you consider perhaps bringing in a mask-wearing scenario for secondary schools?
The cases in the sixth forms started emerging in the last couple of days, and the numbers continue to go up as we test more and more people and results start coming in. So I don't actually have an accurate number of how many active cases we've had today. I had to miss the analytical cell today. I'll catch up later on. But testing continues amongst that group to establish precisely how far afield the COVID has gone. What we do acknowledge, though, is that it is not necessarily the schools themselves that we are talking about. We are talking about of a group of people of the same age in a small island who therefore all know each other and who are friends with each other. And that's one of the beauties of Jersey, of course. And they socialize together outside, of course, the school arena as well. And we've just come out of half term, so that would have given them ample opportunity to socialize. So we need to take into account that aspect of what we're seeing through schools. It's not necessarily the school setting that is responsible for the cases we're seeing in sixth forms. It is simply that age group socializing together, or a bit of both.
So if we're looking at about 100 cases at the moment, what percentage of that could be under 18s, for example?
Well, to date, we've had something, this is from the very beginning of the COVID period, we've had something like 22 cases in those aged between the 0 to 19.
So it's still
So,
relatively small.
but that does not necessarily include some of the recent cases that are emerging from the sixth forms surveillance that's currently being undertaken. So we'll have more accurate information on that in the next few days.
And my second question, I guess is for all of you, but first, Chief Minister, we can see when you're talking about today and it being a critical moment for the island, it seems like we're balancing or teetering on the edge of a potential lockdown. What are the significant moments which could potentially tip us over into stricter measures? Is there a number, for example, that you're looking at that we reach? Is it in the positivity, the rates of positive testing? Is there something that islanders should be looking out for and thinking that's when it gets even more serious?
I think what we're going to say is it always goes back to this balance of risks. We've had that approach all the way through, and it's about islanders' health in terms of COVID. It's about well-being, i.e. wider health, and about livelihoods as well. So there's not going to be one number. There's not going to be one factor. It's going to be essentially a bit of an analysis of what we think certain trends are that are coming through. I suspect, and Ivan will definitely be talking to somewhat more than that, that it'll be, if we've got seeing certain trends, we'll obviously monitor what's coming through on the helpline in terms of calls. That gives you quite an early warning. And also further down the line is your hospital admissions. Now don't forget, hospital admissions at the moment are exceptionally, I think we're still at 0 basically, but so they're very, very low. And so that's why we're saying this is an early warning, essentially, of what we're trying to avoid. And, and even if they just bottom around at sort of 1 or 2 or whatever, that's well, as Ivan's going to be described, that's probably okay. It's if you suddenly see a increase coming through that you don't know where it's coming from and you can't see what the trend is. I think they'll rather suspect there'll be. So there's a range of factors. As Ivan talks about, I think you call it the analytics cell. I know it by the individual who presents to us, and they go through on a regular basis where they are and what the data is looking like. And so there's a combination of trends that they bring together. Actually, Richard, do you want to say anything before Ivan, or do you want to?
I'd just say it's not a single number.
Right.
For example, if we were to see isolated cases popping up all over the island, which we can't connect, then that means there's a significant spread in the island which is beginning to emerge, and that would be something very worrying. As against, perhaps, you might have a cluster with a large number of people in, but if we know how that has come about, and if we can track all those people, control them in isolation, then that is not so serious as the first scenario I've mentioned. So it's about the circumstances rather than a number.
And for me, it's also about speed. So that's why, with the app and with the QR tracing and things like that, the sooner you can get to people, the easier it is to contain matters. And that's why we're again emphasising the point about QR codes and that as an area and all the other measures that we've been talking about for quite some time. You may remember we were in this room at the end of August, again, just flagging up that we were coming to merge out.
Within the short presentation that I gave, we talked about not just the numbers, but also the number of unknown source cases. So it's not just the numbers; it's the description that goes with the numbers that gives us a picture as to what's going on. And of course, clusters will tell us whether, and the number of clusters, the size of clusters will tell us whether there have been super spreading events. So an increase in the overall numbers, unknown source cases, super spreading events, and as the Minister was saying, multiple cases arising across the island. That sort of overall picture will start to tell us whether targeted responses on our part, which is basically identifying cases, quarantining them, looking at their direct contacts and beyond, whether that is enough to contain COVID. Once we start feeling that we can't contain COVID with that directed response, together with maximising public health measures, then we need to start looking at pan-island more harsh measures. That is when the tipping point would occur. At the moment, we believe we're at a point where targeted measures, if properly applied, together with help from the people to institute public health measures across the board, if all that happens, we believe we may still manage to change the direction of travel. But we can't do this by ourselves. We can't just do case finding and alone and manage the whole problem. We need people to work with us to ensure that they reduce the risk of spread of COVID by their actions. That's what this is all about.
Thank you.
Thanks very much. Right, we've got two dialed-in questions, I think, from Harry, from 103.
Yeah, sorry, Harry wasn't able to make it, but he sent me some questions. First one, in light of the recent increase in student cases, parents are concerned and wondering whether to withdraw students from school. Has the Children's Commissioner been contacted at all, and could schools potentially close?
I think Ivan, do you want to comment?
I think the first thing to say is that COVID infection in children, including older children, is actually quite mild and very, very often completely asymptomatic. So the risk isn't of COVID to children. The risk is of COVID being spread from the older children. Younger children tend not to spread it so much to families, to vulnerable individuals, and perhaps spread it into vulnerable sites as well. So that is the risk. Obviously, if there is an awful lot of spread within a school, if the school is actually the source of spread rather than parallel activities, then temporary closure of certain year groups may be appropriate.
And he has a second question along those similar lines. How many students have been sent home in total, and why aren't holier sixth formers being tested?
So, in general, this is in infection in general, not just COVID. If we have infection in a particular locus, we contact trace in relation to that locus, first and foremost, because that is where more infection is more likely to be found. And if the whole notion is to try to stop the spread of infection, you start where you're likely to find the most infection to prevent it, to prevent further onward spread. And then after you've looked at where you think most activity is likely to be, once you've done that, you then start going outwards. And you continue going outwards in a sort of onion ring type fashion until you get less and less return. And at that point, you stop. So translating that to COVID and the sixth forms, activity was seen in relation to 2 schools. They share classes with another 2 schools. It seemed reasonable to start our testing there. Once we've completed that testing, we will then make decisions about testing beyond that locus.
Thank you.
Thanks very much. I think given that it's nearly 5 to 3, I'll start calling that to a close. And either Richard or Ivan, do you want to say a couple of words before I finish at all?
Oh, John, just to reiterate and ask people to act responsibly and follow guidance, because that's what's going to keep us and the island safe and avoid stricter measures.
Ivan, do you want to add anything else?
I completely agree with what the Minister has said. Please help us help you by acting responsibly.
So all I will say is thank you for listening. I'll basically repeat almost what's just been said. If we work together to protect our community and the freedoms we work so hard to keep, retain and keep to date, then we will come through this. We will come through this well, and we won't need to bring in any more draconian measures. And that is all about acting responsibly. And that's what we cover today, things like QR codes, things like wearing masks inside, things about being careful about groups, about parties, even this weekend, about distancing, about hygiene, and hand washing and sanitizer, and all those type of things you've heard me and others say so many times before. We are back in that territory. We've got to do that now in order to avoid future measures. But thank you for listening. I hope you can take that message away with you. And on that note, we'll bring this conference to a close. Thank you very much.